around artificial intelligence integration into F-FDG PET-CT imaging for oncology. Artificial intelligence is a rapidly expanding field, aiding medical professionals in cancer detecting and treatment via F-FDG PET-CT imaging, which utilizes AI through radiomic technology. AI is defined as computer systems which can perform tasks that previously required human intelligence. AI-assisted imaging in healthcare presents a complex ethical dilemma. Despite AI's advances in imaging for cancer management, it raises concerns regarding privacy and data protection, informed consent, social gaps, medical consults, etc. Some nurses express concerns about AI in medical imaging, such as the potential for errors or misinterpretations, the loss of human touch, and the widening gap in access to healthcare resources. Nursing ethics, outlined in the Code of Ethics for Nurses, place compassion, trust, and caring as central elements within the nurse-patient relationship. Therefore, adaptations to AI and F-FDG PET-CT imaging must be made to adopt, support, and enhance these elements to ensure the core values and ethical obligations of the nursing profession. Public policy plays a crucial role in translating these ethical considerations into guidelines, regulations, and laws to govern AI use in healthcare imaging. By aligning these policies with nursing ethics, governments can safeguard patient rights, privacy, and safety while improving healthcare outcomes. As seen in Figure 1, cancer is the second leading cause of mortality in America, with 1.6 million new cancer cases and 600,000 deaths in 2020. Some imaging tools that medical professionals use to detect, identify, and treat cancer include PET and CT scans. In 1998, PET-CT revolutionized medical imaging by combining PET and CT scans, which allowed for precise localization and early evaluation of physiological changes. F-FDG is a positron-emitting radiotracer used alongside PET-CT scans to diagnose and monitor various conditions. F-FDG PET-CT has shown to be very effective for oncology in staging, restaging, therapy response assessment, and reoccurrence detection of different cancers in imaging. Radiologists examine PET-CT scans with the naked eye and make personal judgments about the cancer's tumor's shape and texture to determine future treatment plans. This, however, introduces subjectivity. In 2012, Radiomix, an AI-generated tool, emerged to measure efficacy in PET-CT scans for cancer diagnosis. AI currently predicts therapy effectiveness by measuring tumor changes and scanning thousands of databases where patient outcomes are already known. When a tumor increases in size and becomes more irregular and heterogeneous, this AI-based technology predicts that the treatment isn't working, allowing for physicians to promptly adjust the therapy. The use of AI in F-FDG PET-CT imaging raises ethical dilemmas. The ethical principles of autonomy grants patients the right to make their own decisions regarding their health and treatment, and healthcare informed consent is required to ensure patients' autonomy. As a group, we've decided that autonomy is the most crucial principle in the setting of cancer care, as it is difficult to uphold. It's crucial to uphold a patient's right to make informed decisions about their own care. AI-assisted scans improve diagnosis, treatment options, and outcomes, thereby allowing the patient to focus on their future course of treatment and their expected outcome. Additionally, by respecting a patient's autonomy, their values and preferences become central in healthcare decision-making processes and lead to more personalized and patient-centric care. However, this principle encounters vast challenges concerning medical imaging. Medical images contain protected health information, PHI, which is defined as any information collected via healthcare services that can identify an individual. If AI algorithms gain access to databases, it may access sensitive patient information without proper consent, violating confidentiality and trust. Patients should have the right to decide who can access their health information and for what purposes. However, AI algorithms may use patient data without their awareness, compromising autonomy and leaving them vulnerable to misuse or unauthorized disclosure. Next, beneficence and non-maleficence are the next principles that are relevant to AI-powered F-FDG PET-CT imaging and oncology. Beneficence in healthcare emphasizes the need to promote the well-being of patients, while non-maleficence stresses the obligation to do no harm. AI-enhanced F-FDG PET-CT imaging aligns with the principle of beneficence by improving diagnosis accuracy in oncology along with patient outcomes. Additionally, by minimizing unnecessary procedures and reducing patient discomfort, it upholds the principles of non-maleficence, ensuring that patients receive the most effective and least harmful care possible. Unfortunately, AI-assisted F-FDG PET-CT has the potential to operate in unethical ways through the use of deceptive and dishonest algorithms. Volkswagen algorithm designers used a technique that allowed vehicles to manipulate nitrogen oxide emissions during regulatory testing in order to meet American standards. In a similar way, given the growing importance of quality indicators for public evaluations and determining reimbursement rates, private sector designers may be tempted to teach machine learning systems. This will guide users towards clinical actions that would improve quality metrics but not reflect better care. Such systems might also skew the data provided for public evaluation or identify when they're being reviewed by potential hospital regulators. Clinical decision support systems could be programmed to generate increased profits for their designers or purchasers without clinical users being aware of it. Lastly, AI and F-FDG PET-CT imaging improves tumor detection. Satagahani used convolution neural networks, CNN, to enhance the accuracy of detecting pulmonary nodules. This reduced false positives substantially compared to previous methods like active contour filters, from 72.8 to 4.9 per case, indicating a remarkable advancement in precision. Another study screened data from 3 hospitals in China and found increased accuracy from 57 to 77% by scaling machine learning algorithms and detecting non-small cell cancer in the lungs. These findings underscore that AI integration enhances tumor detection accuracy, transforming the landscape of oncology imaging by minimizing false positives and maximizing diagnostic reliability. However, ethical challenges arise as AI algorithms could potentially incorporate provider bias by prioritizing their patients' needs over others who are in more critical need. This could be due to unawareness of their other patients' information or their personal cognitive biases. Eventually, this could perpetuate biased decision making within AI algorithms. In a recent study, researchers found a healthcare algorithm used in American hospitals which discriminated Black patients. As a result, researchers found that Blacks who had more illnesses than white Americans were designated less critically in need and therefore did not get the additional help that they required. This problem could occur with AI-aided triage algorithms, which could favor one group over another due to implicit biases rather than prioritizing a real emergency. However, arguments for this AI and F-FDG PET-CT imaging were seen in a recent article that examined the role of AI for process improvement and workflow enhancement. The study found that the use of AI automating tasks like lesion detection, image analysis, etc., could potentially alleviate the burden on radiologists and staff, allowing them to focus more on interpreting results and making informed decisions. This streamlines the interpretation process, enabling radiologists to handle more cases in a day without sacrificing accuracy. Consequently, a faster turnaround time and reporting imaging results from physicians become more feasible, facilitating prompt treatment decisions and improving patient outcomes. Lastly, the integration of AI and F-FDG PET-CT imaging in oncology presents several hazards. The primary concern is potential inaccuracies due to using algorithm trainings on specific demographic groups across diverse populations. Variations in ethnicity, age, and sex can affect algorithm performance, leading to diagnosis and treatment errors. Furthermore, the exclusion of low-quality images in certain cancer patients from training sets can limit algorithm representation, compromising effectiveness. As oncology leans more on electronic health records, ensuring equitable access to diverse data sets while prioritizing and protecting patient privacy is crucial. These challenges highlight the need for robust algorithm training and a comprehensive data inclusion to ensure the reliability and efficacy of AI integration in oncology.
Nurses are affected. AI in healthcare can be seen as controversial. There is still a lot of hesitancy when it comes to trusting computers to do important work for you. But studies have shown that artificial intelligence, when used for PET-CT imaging in oncology, that it has provided faster and even more accurate imaging than just reviewing the images after a scan as a medical team. With getting quicker results, this allows for creating an even faster plan of action and hopefully healing your patient with complete success. This doesn't fully affect a nurse's job because it doesn't necessarily take away from what you do. It just aids in the process of diagnosing a patient. And if anything, nurses could benefit from this solely because timeframes are important and accuracy is even more important. The aspect that gets taken away from nurses is the imaging and diagnosis being done for you, but that should almost confirm what you were thinking the prognosis was and guide you in the right direction. Responsibilities within addressing this dilemma. There are many aspects to addressing the concerns within the use of AI in imaging and oncology, just as addressing any other concern within the workplace. Having an open mind is extremely useful because not everyone is going to agree with you, and you are not going to agree with everyone else. But what is important is to address physical differences you may have seen that don't sit right with you and having supporting evidence of other people who may feel the same way. There hasn't been much discrepancy between personal knowledge and AI results, so it comes down to the personal beliefs and opinions on this topic. But if you go in well prepared with a list of changes or new ideas of ethical use or new and improved policies that seem more suitable for you or the workplace, then things could be changed. Since this is still new to the healthcare industry, there isn't an immense amount of backlash, but everyone has the right to their opinions and addressing their concerns. What challenges are faced when integrating AI into imaging? There are many aspects to addressing the concerns within the use of AI, just as addressing any other concerns within the workplace. Having an open mind is extremely useful because, again, not everyone is going to agree with you. But what is important is to address physical differences and having supporting evidence of other people who may feel the same way about you. But other challenges are that not every hospital has up-to-date technology. So accommodating AI into their scanning may not be compatible. Not everyone is tech savvy. So like learning stuff like this and trying to adapt into a more technology driven environment can be hard for people to, I guess, agree with or like dapple into. And then obviously funds are a big issue. Not everyone is going to prioritize paying for AI to be used when you could just use the machines you already have and use the knowledge from the staff that you already have.
One of the two policies we found that related to our issue was the Healthy Technology Act of 2023. This is a bill that allows artificial intelligence to be considered licensed practitioners, which means they will be allowed to prescribe certain medication if the version of AI being used to prescribe said drug is approved by the state it was created in, as well as the Food and Drug Administration. The main act to address unsafe staffing of nurses was the second policy we found. This is a bill that outlines minimum requirements for patient care by having an amount of nurses on duty or standby that equally take into account specific patients' needs at any given time. The 12-page document provides a lot of expectations for nurses that not only protect them, but the patients as well by ensuring there is an equal balance between rights of the patient to considerable treatment and rights of the nurse in safety, time off, and other areas. Some pros that could come out of the Healthy Technology Act would be the doctor's ability to gain a second opinion on the drugs that they are prescribing to patients, while also having the potential to prescribing medications more accurately. Every year, 237 million drugs are misprescribed in England, and to combat this, doctors have come up with an artificial intelligence called Drug GPT. The program has the unique ability of being able to flag anything that conflicts the medication with any existing factors or conditions that may affect the patient, making for an efficient system that can correctly identify problems. The AI is also helpful for the patients as well, as it can more accurately show the patient the time schedules and routines they should follow in regards to taking their medications. With patients that take many different medications, mostly being elderly, a better and more clear schedule is something that many argue to be important. This AI is very similar to the ones that the Healthy Technology Act of 2023 have in mind, and if done correctly, they can help speed up the process of prescribing medication to patients. Some medical professionals are concerned with the bill, however, mainly because of the human maintenance that it will require. AI can become outdated quickly, especially with developing medical technology and information every day. It can be easy for AI to become out of date and give inaccurate information. Some AI, like ChatGPT, can falsify information to satisfy the question that's being asked of it. Professionals and economists also argue that that could cause a shortage in healthcare workers. While many see the main act to address unsafe nursing as much needed, there have been concerns that this bill will further increase patient wait time and treat the patients more as numbers than individuals. The Maine Hospital Association has noted that they are disappointed in legislatures, adding that they cannot hire 1,000 nurses that they do not have. As well as the hospitals, the Maine State Nurses Association seems to take issues with the bill as well. Union President Koki Giles stated that while many of the current ratios were noted to be unsafe, nurses were still going home crying most nights because they didn't feel as though they gave enough adequate care to the patients. With a typical caring period of an hour to an hour and a half between patients, it seems like a long time, but when it comes in certain intervals and you're also trying to balance other patients, it can quickly become overwhelming. Another noteworthy part of the bill that relates here is the banned use of artificial intelligence algorithms in healthcare facilities. It also notes that technologies that punish nurses for overriding these technologies and giving independent opinions are also banned. These two parts of the bill serve to make sure that AI doesn't overtake the valued opinion of a healthcare professional and to also make sure that nurses stay unpunished when an algorithm doesn't agree with their assessment. Some recommendations for public policies may include ones that strike an important balance between allowing artificial intelligence to give a reasonable opinion through its algorithms, while also retaining the integrity and importance of professional human opinions from healthcare professionals that have worked in the field and gone through the training to give the best advice possible. It's important to note that algorithms like DrugGPT have been useful in eliminating human error in regards to medication distribution across the seas, and the Healthy Technology Act backs this up in the states by allowing algorithms to exist. However, while we are still navigating the new world of artificial intelligence, we are also realizing the boundaries that should be held on them. The Maine Act to address unsafe nurses fixes this by restricting the punishments given to nurses who go against the recommendation of AIs. So in totality, more acts like these that can find a balance to regulate AI while also finding a healthy way to integrate them into the medical field is probably our best solution to tackle AI moving forward.
Stephanie, you're muted.
Are we good now? Overall, the incorporation of AI in the use of imaging has more promising pros than cons. One of the bigger concerns is that since computers hold such important and confidential information, if AI algorithms happen to get access to the hospital's databases, then all this sensitive information would be at risk of being viewed by others without consent. As said, there's also concern with how accurate this technology really is, but stated earlier, the number of false positive cases have dropped from 72.8 all the way down to 4.9. That is a major improvement and a very small number of cases to have false positives. Nurses are also capable of misdiagnosing patients based off of their own knowledge. Other than those concerns, there have been very minimal resistance with nurses in accepting the idea of AI in healthcare. If you are one who wishes to push back this idea, there's a list of things you can compile to present to the board, and you are fully protected if you wish to express your opinions and or concerns. The pro is that this currently is appreciated of how fast AI can diagnose and provide such accurate information, and the speed being so much faster than like nurses or doctors reviewing and then talking about a diagnosis and then creating a game plan. This kind of speed and accuracy allows the care team to almost immediately come up with a care plan and getting started right away with taking care of the patient. As for our opinions, we came to the agreement that this could be revolutionary for healthcare. Minus the very small amount of false positive cases, we believe that this will provide faster and more accurate information and be an amazing aid for nurses. After conducting this research, we have realized that this form of technology was not created to take away from a nurse's job, but to make it faster and easier. This kind of speed and accuracy in imaging will only make the nurse's care plans better and more personalized for the patient and help the patient's outcome be as good as possible. We believe at this time that AI being used for imaging is doing more good than harm and is paving the way for healthcare to continue having a successful future.
Okay, and then our next slides are our references. Okay, that's our presentation. Thank you.